Good afternoon. Welcome back to the Future of Medicine program. For those not in attendance yesterday, my name is Lindsay Coate. I'm the Vice President of Strategic Operations here at the Sierra Sacramento Valley Medical Society. I'll be facilitating these sessions for you guys over the next 2 weeks. Let's get started. Our first session today is about careers in public health. And I'm thrilled to welcome Dr. Aimee Sisson. She is the Public Health Officer for Yolo County Health and Human Services, and Lynnan, Svenson, the Public Health Division Manager and Director of Public Health Nursing for Sacramento County. Now, their session will conclude with questions and answers and an awesome activity that will absolutely require your participation. So please be ready to chime in and help Dr. Sisson out with this activity. Now, remember to add your questions to the chat or raise your virtual hand. And again, I will read your questions or call on you after both Dr. Sisson and Lynnan have had a chance to speak. So please welcome Dr. Sisson, you're up.
Well, thank you, Lindsay, and good afternoon, everybody. As Lindsay said, I'm Dr. Aimee Sisson, and I'm the health officer for Yolo County. And many of you might be wondering what a health officer is or does, and we're going to talk a lot about that today. But basically, I'm a public health doctor who looks after the health of everybody who lives in Yolo County. And I think most of you, if not all of you, live in Sacramento County, so just a little bit of orientation that Yolo County is your neighbor to the west, and Yolo County includes the 4 cities of West Sacramento, Woodland, Winters, and Davis, plus a lot of smaller towns and rural areas. You know, health officer is an interesting job because we're mostly behind the scenes, and when public health in general is doing a good job, you don't know that we're there. And most people hadn't heard of health officers until the COVID-19 pandemic came along, and suddenly we were on the news all the time because we were issuing orders for people to stay home to protect themselves from coronavirus. A public health doctor is different from other doctors because I take care of entire populations of people instead of just one person at a time, like an emergency room doctor or a primary care doctor. And instead of using a stethoscope, for example, or pushing on somebody's abdomen during a physical exam, I look at numbers to tell me how my population is doing. So for example, how many people who live in Yolo County have diabetes, and is that number going up or down? These are the types of questions that I ask myself. And then I come up with a treatment plan for how to make things better. And rather than prescribing drugs like a primary care doctor might do, I come up with policies and programs. So if the number of people in Yolo County with diabetes is going up, maybe I'll work to get more grocery stores into neighborhoods that currently just have a lot of fast food restaurants. So if I had to sum up what public health is all about, it's about creating conditions in which people can be healthy. And being healthy, as you all know from your own experiences, it's about a lot more than going to the doctor when you get sick. It's about not getting sick in the first place by doing things like exercising, eating well, not smoking, for example. And what a lot of people might not think about is that your ability to do those things, to exercise, to eat well, and to not smoke is influenced by what's around you. So if there aren't any parks in your neighborhood where you feel safe playing, it's going to be hard for you to get exercised. I love being a public health doctor because I get to help a lot of people all at once. So a doctor that does individual patient care, which is much more normal for doctors, might take care of about 30 people a day. I get to look after 220,000 people. That's the population of Yolo County on a daily basis. And so, for example, when I told everyone that they should be wearing masks during the pandemic to protect against COVID-19, that helped keep thousands of people safe. So going backwards a little bit, you might be wondering how much school it takes to become a public health doctor. So after high school, I went to 4 years of college and then 4 years of medical school. And then I also did an internship for a year where I took care of patients in a hospital. And I didn't always want to be a public health doctor. When I was in medical school, I really liked anatomy, and I was in love with this idea of curing people by cutting out their disease. So I actually did my intern year in surgery and was planning on becoming a surgeon. But after a year, I realized that I didn't really love surgery enough to do it 70 hours a week for the rest of my life. So I decided to go back to school to learn about public health. And I'd been interested in public health since I was a kid, and I'd read a book about an Ebola outbreak in Africa. And I thought it would be really cool to investigate these mystery diseases where people were getting sick and you had to come in and interview people, talk to people, and figure out where that disease could be coming from, what disease it was. So I spent a year getting my Master of Public Health degree, and then I did a year of residency training at the State Health Department, the California Department of Public Health, as well as the County Health Department. And during that year of residency training, I got to work on real-world projects that taught me about different areas of public health, including infectious disease, chronic disease, like heart disease, cancer, environmental health, doing things like restaurant inspections, child health, programs to promote health, such as healthy eating and tobacco control, and then also just in general how public health departments work. And I was really lucky that when I finished my training, I was offered a chance to stay in a full-time job at the State Health Department here in California. And for the next 10 years, I worked on a lot of different projects at the State Health Department, asthma, obesity prevention, some healthy neighborhoods work, something called Health in All Policies, mental health, health equity, and also teaching young doctors and data scientists about public health. For a while, I got really interested in how to get healthy food like fruits and vegetables to more people. And I actually decided to take a break from working in an office. And I worked on a farm for several years, learning how to farm organically. And then I actually ran my own farm in West Sacramento for a couple of years. And my favorite parts of farming, which I always saw as an extension of public health, was about working with the kids in the neighborhood around my farm. It was mostly elementary school kids, and getting them to try new vegetables, and then also selling my produce at the farmers market, where I got to meet the people who were eating the food that I was growing. So I really felt connected to them. But after a while, my body got really tired from the hard work in 100+ degree weather in the summer, crawling around on the dirt in my hands and knees. And honestly, I wasn't making very much money as a farmer. So I decided to go back to the office again and work full-time as a doctor. And after about 10 years at the State Health Department, I decided to go work at a local health department because I wanted to feel closer to the communities of people that I was helping. So last October of 2019, I took a job as a local health officer in actually another county, Placer County. And about 3 months into my new job as the local health officer, COVID hit and my life became absolutely crazy. I went from nobody knowing who I was or having heard of who the health officer was to being on the news all the time. I was working really long days trying to keep everybody safe from this brand new virus that we didn't really know a lot about. Some nights I even slept on a cot in my office because it meant that I could get more sleep if I didn't have to drive home and back. I have to say it was the busiest, hardest, and most stressful time of my life. But at the same time, and this might sound strange, but it's been the most fulfilling thing that I've ever done in my career as a doctor, because I felt like I was really making a difference and helping to save people's lives. Don't get me wrong, though, just like most, if not all of you, I'm really looking forward to the pandemic ending and getting back to something that looks more like normal, doing things like this meeting in person instead of over Zoom, looking more like things were before COVID. And so I think the health officer experience during COVID is very different than what the health officer experience was like before COVID. So let me paint the pre-COVID picture for you of what a typical day looked like. I would get into my office about 8:30 in the morning. I would check my email and respond to anything urgent that was there. And then I would meet with members of my public health team to talk about different topics. Often those were related to infectious disease. Infectious disease takes up a big proportion of a health officer's time. Things like tuberculosis or salmonella, foodborne illness, as well as respiratory diseases like influenza in the wintertime. I would often meet individually with some of my team members because I was supervising a whole team of managers and running the health department. So I would check in with that team member for about an hour to see how his work was going. And then I'd also, on a typical day, would meet from someone from another agency or from the community, from a business about a health issue. So, for example, I might meet with the police chief for one of the cities in the county to talk about how we can work together to prevent kids from using tobacco. In the afternoon, I would be back on my computer, checking and sending email. I'd also be returning phone calls from people who had called during the day with questions, and then I would usually head home around 6:30 at night. So that was kind of my typical day. Like I said, things during COVID have been a bit crazy. The days have been longer. I don't necessarily go into the office. As you can see, I'm working from home today. I'm joined by my faithful sidekick, Lucy, who is so excited by this presentation. She's sleeping right through it. But that's one of the nice things about the pandemic is getting to work from home. But I also do really miss being in person. And, you know, one of my professors, when I was getting my master's in public health right down the road at UC Davis, would always say that public health is a team sport. And one of the best parts of my job is the working with the great team of people at the health department. And that team is made up of other doctors, as well as nurses, data scientists called epidemiologists, which has kind of become a household term over this last year. But again, nobody had ever heard of an epidemiologist before last year, as well as social workers and many other members of the team. And I have to say that during COVID, my team and I grew really close together because we were working long hours together during a very stressful time. And I spent more time with my team at work than with my family during the pandemic, and they became like a second family. One theme that I want to emphasize of my own journey from high school to becoming a health officer in Yolo County is that the path from one to the other was anything but a straight line. I had this vision of my life as being very linear, like I would go from high school to being a doctor and everything would be very smooth and easy. And I started out actually wanting to go into family practice. And then in medical school, I changed my mind and decided to become a surgeon. And then I ended up becoming a public health doctor. And then I took a break from working as a doctor for a few years and became a farmer. So I like to call my career path the scenic route. But I think, and what I want to emphasize is that everything that I was, learning along the way, like every stop on that crazy road trip through work life was teaching me something important and useful that I would end up using further down the road. I never would have guessed when I was in high school that I would end up being the Yolo County Health Officer, but I have to say that I could not be happier doing what I am doing now. So my point is that if you don't know where you want to end up right now, that's okay, because even if you think you know where you're headed, you will probably end up taking some detours along the way. So my advice is that wherever you are, learn what you can while you're there, and you never know how you might use it someday. So for example, my work as a farmer, some might say like, how does that benefit you as a health officer? But there's a lot of work in Yolo County in the area of agriculture and trying to expand farming, especially urban farming in West Sacramento. And so I actually on Thursday will be going to the launching of a mobile farmers market program in West Sacramento. And so my connection and my experience on the ground as a farmer helps me to connect with the agricultural community and help me to understand the needs of food insecurity, people who may not have access to a grocery store, to a farmer's market, and healthy fruits and vegetables. So I have perspective on the ground of what it's like to work in agriculture. So again, you may not realize how you're going to benefit from something along the way, but I can almost guarantee you that if you just do your best and listen and learn, you will pick up things that will benefit you later in life. So that is the end of my story, and I'm going to hand it back to Lindsay for our next speaker.
Great, thank you, Dr. Sisson. Lynnan, are you ready to go?
I sure
Looks like it. All right, it's your turn, and students, if you have questions for Dr. Sisson or Lynnan, then please add them to the chat function, and we'll go over them at the end of Lynnan's presentation. All right, take it away.
Great, thanks, Lindsay and Dr. Sisson. You did a great job explaining public health. So I really appreciate that. It gives some context to what I'm going to be talking about. It's really exciting to talk to all of you. I love talking with students and people that are entering their careers and planning for their careers. So thank you so much. And, you know, I really love public health. It's one of the best choices that I've made in my profession. And I'll talk to you a little bit about how I came about being in the profession. When I was young, I knew I wanted to help people. I knew that from the time I was super young. I was a lifeguard at 14 and continued that path of assisting individuals. I became a job coach for people with intellectual and physical disabilities, and then said, you know what do I want to do in college? And what I decided to do was become a nurse, because I had heard from a few mentors that I had that in nursing you could do a variety of things. And I very much like doing a variety of things in my life to be intellectually stimulated. And so I decided to pursue my bachelor's degree in nursing. I had also heard from some people that you can go the associate degree route and then circle back and get your bachelor's degree. But I knew that once I started making money and, you know, having a family and that type of thing, it might be difficult for me to do that. So I got my bachelor's degree in nursing and got married really, really young. I had a college sweetheart. We got married and decided to, you know, continue our educational path, which was wonderful together. And after I graduated, I found a job. It was a time that it was sort of difficult for nurses to find jobs. So I found a job in a neonatal intensive care unit. And that was wonderful, working with the little micro preemies and premature infants and infants that have other health issues. And I enjoyed that for the first couple of years, like 2.5 years of my profession. And then we were moving to the Sacramento area for my husband to finish school. And none of the higher level intensive care units were hiring in neonatal intensive care. So I thought, you know what about if I take care of the infants once they go home? And I knew about public health nursing from my baccalaureate program. I had really enjoyed it, getting out in the community and working with patients in their homes and working with the whole family, not just working with the particular patient that was referred to you, because the whole family affects the health of that one individual in the home that's having the medical issues. So I got a job with Sacramento County Public Health, and I was assigned to Del Paso Heights area, as well as the North Sacramento area. And it was really interesting for me because I had grown up in Bakersfield and in like the Southwest area of Bakersfield. And I hadn't really had the experience with diverse ethnic and ethnicities and cultures. And so that was a wonderful experience for me. For the first couple of years, I did what was called field nursing then. And I did things like communicable disease follow-up, lead follow-up. I did high-risk infant follow-up and high-risk pregnancy follow-up. And after a couple of years, I had an infant that I had, my daughter I'd been taking to daycare, and I was taking her there so much, it bothered me. I wanted to be home with her more. And I was gone from her about 50 hours a week. So I decided to pursue a part-time job in public health. And I became the hepatitis B perinatal outreach coordinator for Sacramento County, and did that for about 6 years so that I could be there more so with my daughter. That was a half-time job. And then I worked every other weekend in the hospital one night in the neonatal intensive care. And I could make the same amount of money between those two jobs as working full-time in public health. So I did that while my daughter was young. And then that was in the immunization program. I really enjoyed delivering immunizations. I feel like immunizations are so important for the health of our communities. And it was something that I could hold on to that was like typical nursing task, right? That you think of when you think about nursing, or the community does. So within the immunization program, I promoted to the immunization coordinator in Sacramento County, but I was able to keep my part-time status. My director of nursing knew that that was important to me. And so I was able to do that. So I had that work-life balance. I stayed there for about 6 years. And then after H1N1, I was really stressed out. There was a lot going on in the immunization program. They also had Tdap requirement for all ages in school, which was a huge venture to embark on right after H1N1. And so I became aware of this job in El Dorado County where I could be a supervising public health nurse again, and or period. I had never been a supervisor. I went right from being a public health nurse to a manager. And we had always wanted to buy a piece of property. So came up to El Dorado County, bought ourselves 5 acres, built horse like a barn and an arena and a huge garden and things like that, and became the maternal child adolescent health director, which that particular program, which is called MCAH, helps to intervene with women that are pregnant and fathers and children, and including adolescents and also young adults, to help improve outcomes in those populations by doing those things that Dr. Sisson was talking about in relation to changing what programs are available in the community to support populations. So making sure that there's enough places for kids to get birth control, or doing education on things like impact teen driving, which is about distracted driving, and trying to, because that's something that impacts a lot of adolescents, crashes and deaths due to distracted driving. So worked in that program and also oversaw the immunization program. And after a few years, became a manager. We kept taking on more and more programs, and they saw that I had been a manager previously. So took on that role and continued to take on more programs, was able to develop some really great programs with some community partners. And that was very fulfilling for me. We had a project called Community Hubs that we had a public health nurse, a community health worker, and early literacy specialist, and a early childhood development specialist. We all work together to help build the strength of our communities and families, build resiliency. And that was really exciting. We combined all of our money and our scopes. And after about 10 years there, I ultimately became the director of nursing there. And after about 10 years, this job that I'm currently in Sacramento County became open. And I had always wanted to be the director of nursing in Sacramento County when I was there as a public health nurse. And I decided to go back to Sacramento County, and I'm really excited to be here. I did pursue about 4 years ago, I ended up going back to college and I got my master's degree in nursing. And it's never too late to continue your academics. And I have to tell you that that master's degree in nursing helped me to refresh all my nursing skills. It also helped me to get the job that I'm currently in. That's how I sort of stood out between another candidate that I was sort of neck and neck with. And so, I would encourage you to pursue your education no matter how far along you get in your career. I had just done it personally as sort of a goal for myself, but it ended up paying off for my career as well. And so anyway, I really, really, really enjoy public health. One of the reasons why is you get to work with not just individuals, but families and entire communities, and get to affect the health of the entire community by doing community level interventions and working with partners. And it is a team sport. You have to work with everybody in the community, all the community-based organizations. We work with like La Familia and Asian Resource Inc. and lots of community-based partners, Sierra Health Foundation, and lots of people who, all of us working together to make healthier policies and supportive programs, and help to really wrap our arms around Sacramento County can help an entire community. And some of the things that we're struggling with right now are things like sexually transmitted diseases. I know that's not a lot of fun to talk about, but it is something that's very prevalent in Sacramento County. And syphilis is not looking good. So, make sure you keep protected. Also, suicide in teens is something that is very much of a concern right now. And we are working on that with our MCAH strategic planning. And obviously health disparities. We have a lot of very unique cultures and ethnic populations, and we have great disparities amongst those populations in Sacramento County. And that is something that we really want to continue to work on. And one thing that's really great about COVID is it has given us the opportunity to receive more money so that we can start to work on some of those things more diligently and have assigned staff to just focus their efforts in those areas. So that's one thing about COVID that has given us additional opportunities, is by giving us additional monies. A typical day for me right now would be, as Aimee said, checking emails. You always have to make sure you stay on top of those high priority emails, because you never know who's emailing you and wanting some sort of response, including your managers or staff. And then I usually end up facilitating multiple meetings throughout the day. So whether that's with public health leadership, or whether that's a community meeting or what have you, I really, really enjoy facilitating meetings and working with a lot of our partners. And I usually, as well, in a day, present in some fashion, whether it's to our department director or in the community. And I really appreciate those opportunities. I have 10 direct reports right now, and they're all managers. So part of my day is meeting with them. How can I support them and make sure that they're moving forward and have all the resources that they need to do their work. And then going back to my desk work, responding to emails, maybe doing some strategic planning with Dr. Kassirier. And, I really feel like medicine and nursing are great partners with one another. We have unique skill sets that we bring to the table. And so I really enjoy being in partnership with Dr. Kassirier to help run the health department. It's very much a joy, and I feel very blessed to be in my current position. So speaking a little bit about, something that made a great impact on me. When I was working in field services for Sacramento County, I had to go to this area in Sacramento. Well, I had the opportunity to. I'm going to say that differently because it was something that gave me great experiences. So I went over to North Sacramento, and there was this apartment complex that all the other public health nurses were like, oh, you've got to go there. Oh, you know, be careful, and everything like that. And when I first went, I have to say I was a little scared. I was holding my infant scale really tight and, you know, ready to, you know, drop it and run or what have you. Took a county car just in case anything happened, made sure I had comfortable shoes on. I went in and I met with this family that had a high-risk infant, and CPS was working with them. And so I also had the opportunity of working with them. My job was really to advocate for the health of their family and anything that might impact the health of their family. And so I worked with them to make sure that they were connected to resources. I always brought a bag of condoms, measured and weighed their baby, did developmental screenings on their baby, and did health education with them. And the first couple of times I didn't feel very safe. But subsequent times, what was really cool, once I earned the respect of the family, the husband would meet me out at the street, and he would always walk me in, escort me in, and make sure that I was safe. And he did the same when I was leaving. And they became more and more engaged, and they really started to make those meaningful changes for their family. And what was really cool was after I'd been involved with them for about 6 months, there started to be a line at their door when I would come, and people would actually ask me questions about community resources and any nursing questions and things like that. And so it was safe and everything, but I just thought it was really neat that they had spoken with their community, which was their apartment complex, and they all decided I was their resource, their health resource. And I was able to, you know, connect people to different areas and different community resources that helped all of them. So that was really impactful for me, and I appreciated that. And, you know, being in the hospital was great too, and working with families with their sick and or when I was able to work on like a postpartum or L&D unit, working with people during that exciting time in their lives. That is a really great opportunity, but being able to impact communities on a broader scale and really help, you know, thousands of people at the same time is something that is so satisfying. And, you know, one thing as well is I'm a little bit, let's just say, I like to be in charge, right? I think that's why I'm in the position that I am. And before in the hospital, it almost felt like sometimes you weren't in charge. You were doing what the doctor's orders were. You know, sometimes you would bring things to the attention of the physicians, because obviously nurses care for the patients in the hospital for a lot of time, and maybe physicians might not have as much interaction with them. And so they rely upon your eyes, ears, and touch of the patient so that you can bring things to their attention. But going into public health was so cool because, you know, in the immunization program, as I became the expert in immunizations, I got to tell doctors what to do sometimes, you know, as far as, you know, this is my recommendation, you need to follow these guidelines. And, you know, I got to present to physician groups and collaborate with physicians more so in a way where we were peers versus being in a hospital setting. So for me and my rebellious kind of, you know, leadership, take charge personality, that was something that is very attractive to me. And I do see how we have to work together, or we get the opportunity to work together to serve communities. And a lot of programs in public health are public health nursing programs. There are many things like I said, maternal, child, adolescent health. We have our child health disability prevention program, our childhood-led poisoning prevention program. We have nursing that works with our CPS unit to go out for emergency responses, and also to help the social workers with medical issues. There's so many opportunities for nurses in the health department. that it is a great area to go into, and there's a wonderful retirement system. So I would say if you are interested in nursing, you want to be out in the community, that it isn't a good opportunity. And I saw a question coming in that asked if I was ever uncomfortable about, is it okay if I answer a question now, Lindsay? Okay. In a particular situation, yes. There were multiple times I felt uncomfortable in the field, but what we teach our nurses is if you ever feel uncomfortable or unsafe, you do not have to go into a home, or you can leave a home. We don't want anything to happen to anybody. We train people where they should sit in the home, how to park their car, how to communicate effectively if something happens, all of those things. But there was this one situation where I went to work with a family that had been involved with CPS for 8 of their previous children. And they'd all been taken away. And I was going in with their 9th child, and they had a lot of dogs, and the dogs weren't very nice. And I was sitting there, and I was trying to provide some support and anticipatory guidance, which is like health education for the family. And basically the father got in my face and just said, "Who do you think you are? You're here with, this is my family. We're going to raise them how we want." And I just said, "I hear you, but I am here to advocate for you. But I think right now I should leave, and we'll connect at another time." And I left. And so that was the most uncomfortable I ever felt in a home, but I was able to freely leave. There is a certain level of respect that you do receive if you present yourself in a way that you treat them respect as well. And as far as what do I think the biggest health issue is for teens, I'll answer one more question and then I'm going to need to turn this over. Is right now, I would go with, we have a lot of mental health issues in our teens and young adult populations. And it was bad even before COVID and all the isolation, and that exacerbated all of that. So that leads to the self-injury, self-harm as well. So I would say that, and things like anxiety and depression, isolation, and those are our biggest challenges today for our teen population. Thank you so much.
Dr. Sisson, I think you should also take the opportunity to answer the same question with respect to Yolo County.
Yeah, I'm going to completely agree with Lynnan. That's exactly what I would have said. It is mental health, particularly as a result of COVID. But it's always hard to be a teenager, but it's particularly because it's a time of transition and learning about who you are. And but throw in a pandemic where you can't be around your friends, where you're spending a whole lot more time around your family who might be driving you crazy. It is, and not learning in person, suffering, the struggles of distance learning and not having enough bandwidth or internet connection. It's just been really hard. My partner's a high school teacher, so I think I have a bit of insight into what it's like to be a high school student during a pandemic, and it's not easy. And so we've seen teenagers really struggling, and in Yolo County, unfortunately, we've had a few teenagers who have committed suicide. And so we are working really hard to connect teenagers with mental health resources, especially now that they're back in school. But one of the things that I've realized is that it's really hard for teenagers to sometimes get the help that they need when they aren't in school. I heard from another teacher friend about a student who was really desperately needed help, but did not have a cell phone. And all she had was Zoom to try to connect with an adult who could help her. And so it was very challenging for that student. And eventually she was able to get the help that she needed. But I think the biggest issue right now that we're seeing in teenagers is mental health issues. And there was just a study, so it's not just in Yolo County or Sacramento County, it's across the United States. They looked at teenagers who were coming into emergency rooms because they had tried to kill themselves, and those numbers went up, particularly in teenage girls. So we are spending a lot of money and paying a lot of attention to the mental health of high school students and junior high.
There's a question for you in the chat, Dr. Sisson.
Yeah, is it hard coming up with plans? I think we do work as a team, and we work in collaboration with the school system. So it's, I talk with the county office of education and their superintendent, and we had a recent funding opportunity that came to us, and we teamed up with the county school district and said, how can we work together and what should we focus on? How could public health help schools? And they said, absolutely, we need money for suicide prevention in our high schools. And so they already had been working with someone who that's what they specialized in, and they had a program that had been proven to work. And so we gave them a fair amount of money. And so that work will be starting up when kids come back in the fall. So I think in this case, it was fairly simple because we already knew of a program that could work that just needed funding and resources directed to it. So I'm really happy that we, it's because of COVID, it's a rare opportunity in public health where we actually have enough money to do our work. Normally in public health, because we're so behind the scenes, we don't get a whole lot of money, and it's hard to have the resources to put into the programs and the staff to really help the public. But because everyone's realized how important public health is because of the pandemic, there's now more money coming towards public health.
We'll take one final question before we go into the activity. Karina's asking, adding to the question above, making plans, do you put yourself in a teen's shoes, or do you make plans as an adult trying to help teens? That's an excellent question, Karina.
That is a great question. I'd like to think that I do both. Obviously, the perspective that's easier for me to take is as an adult, as a public health professional. But I think it's so important to take the perspective of the people that you're serving. And oftentimes we do that in public health by talking directly to them, doing things called focus groups, where we would get a group of teenagers together, maybe a group of teenagers who are struggling with mental health challenges, and talk to them about what their experiences are, what barriers they're experiencing, whether it's, lack of cell phone, lack of, a way to reach out to people for help. So I think it's really important to take both perspectives, but sometimes we do, when we get in a hurry, we forget the importance of really taking the perspective of those we're serving. So thank you for that reminder. And I don't know, Lynnan, did you want to add anything to that?
The only thing I wanted to add is it's so important to have leaders, student leaders, whether they're formal or informal, that really help work with other students and take that leadership role by maybe identifying kids that are might be suicidal or having difficulties, and help support them from a peer perspective, but also help support them by, if it gets bad enough, reporting to somebody so that they can get the help that they need. So important. And we really rely on all of you basically to help support our community and other teenagers. So.
Great. All right, guys. So next, we're going to let Dr. Sisson introduce the activity that we all need you all to participate in. Dr. Sisson?
All right, let me share my screen, maybe. Hang on. All right, let's see. It's just going to take me a sec. I do this every day, but it's harder than it looks. Okay. And let me, oh, that worked out well. Okay. Hopefully you're seeing a screen that says, what does a healthy community look like? Okay, great. So this activity, both Lynnan and I talked about how your opportunities for health are really, and for you as an individual to make quote unquote healthy decisions like eating healthy, exercising, are really determined by what's around you. It's not just, um, the decisions that you make as an individual, but they're shaped by your environment. And I wanted to get you involved in the thinking about all the areas that we touch on in our public health work and that influence the health of the community itself and people in that community. And so I'm hoping that you will participate in this brainstorming activity. So the question I'm asking you, and I'll write down your answers, and then we'll kind of discuss it at the end and compare it to a list that other groups have come up with. But what does a healthy community look like? What is a healthy community? And another way to phrase this question is, if you could live anywhere you wanted to live, what would that community look like? What is the community that you would like to live in, have in it? So there's a few ways you can participate. If you're more shy, you can put your answer into the chat. You're also welcome to raise your hand like this, or to raise your little virtual hand in Zoom, and we will call on you if you raise your hand or if you put it in the chat. And I'm going to pull up the chat so I can see it. There we go. I'll put it over here. Oh, you guys are seeing yourselves, aren't you? Okay, let's move that. Okay, so I'm seeing some answers in the chat already. So I am gonna start typing here, and then Lindsay, if you'll do me the favor of calling on folks. So let's go with.
Okay, so you're looking at the chat. So I will call on, let's see. Miss Perez, you are up first. And how do you say your first name?
Oh, it's Audi.
Sorry. Okay, go ahead.
I would say it would be a good support system.
Thank you.
Can you say a little bit more about what the support system would look like?
Like you could reach out to them, like if you're having, like, for example, any like mental health issues or like stuff going on at home, and you could like go and talk to, there's like opportunities to help to go and talk to them.
Great, thank you so much.
Next we have Javier.
Can you hear me?
Yes, we can hear you.
Okay, well, good afternoon. I will definitely just basic thing will be clean and maintain for parks and recreational areas. It's a basic thing, right? So yeah.
And I see a request to make the screen bigger, so I'm going to work on that. I think. Okay, hopefully that helps.
That definitely helps. Did you see the easy access to medical care? There you go.
Yep. I'm going to go back to the beginning because I'm thinking that I missed some respect. What else describes a place that you would want to live? Think about the things you do every day, like eating, getting places. Abigail?
I said accepting.
Okay, let's put that here. Can you say more about accepting?
Right, so like it could be
ahead.
of your sexuality, of like your disability, of your race, basically of the person you are, so you feel safe being who you are.
That's great. Absolutely important. I'm seeing mental health services.
Making sure you saw the technology accessibility.
Yep, I'm going back to safe and healthy homes. Housing is so important.
Okay.
Mariana, cleanliness. Can you say more about what you mean?
What I mean is like more like recycling bins, garbage bins to like keep like the community clean.
Okay. What other things in the environment might you want to keep clean?
Like our parks, the rivers, the ocean. Depends where
Yeah,
you live.
so clean water is an important one. It's you know, something we drink every day. We need to bathe in it as well, and it serves so many purposes. So we'll go with sanitation, garbage. All right. What else did I miss in the chat? Mental health, technology.
I'm going to call on someone. Yep, technology. I'm going to call on someone next. I think it's Ashish. Is that how you say your name?
Yeah, that's pronounced right.
Perfect. All right, go right ahead.
So I was kind of saying that having like a solid education system, it would kind of help to make sure everybody knows what's going on in the community, and I guess having the education to know what to do right and wrong.
Transportation, great. Yeah. Saha, you put transportation in. Can you describe that transportation? What does healthy transportation look like to you?
Like we can have access to more buses and stuff. Not a lot of people like have cars and
Great. Yes, thinking about what sometimes we call them alternative modes of transportation or public transit, but you know, I don't like the word alternative because I'd like it to be the mainstream. When people walk or bike or take public transit, they're more active, and it helps prevent chronic disease, and it also helps reduce pollution, and that's something we haven't talked about yet. But I'm going to go ahead and put clean air over here, because that's something else that impacts our health. When you think about the wildfires last summer and how disgusting it was to go outside because the air was so nasty, really pointed out how important clean air is for our health, but sometimes we take it for granted when it's there, and it's not till it's gone that we really appreciate it. I see Mariana put in an item about learning about like financial literacy, I think is maybe a good way of, if I had to rephrase that, but education on life after high school, learning about insurance, credit, and taxes, absolutely important. It's hard to stay healthy if you don't have enough money to support yourself and your family.
We're going to take time to add just a couple more, Dr. Sisson, so that you can show the comparison.
Absolutely. Thank you for keeping me on track.
There's a couple more here. Somebody mentioned having a place to enjoy good music and entertainment is I think where that might be going. That's a good one. Protecting citizens from diseases. Psychology, a good environment, nature, which is kind of what you talked about with clean air, clean water, clean parks. I think that was everything. There's one other person that had their hand raised. Javier, if you can go quickly, go ahead and go.
Oh yeah, can I add to one of the people who said something about spreading dietitian or something like that, educating I feel like adding to that, maybe more in like in the obesity, diabetes side. I think, you know, a lot of people, especially in the minorities and lower income. And also, what was I gonna say? Affordability to fruits and vegetables, you know, things like that. Example, real quick, I was at work yesterday. It's like a vending machine. A bag of chips was $1, and I was like, you know, I'm craving some fruits. I bought a little small bag of fruits. It was $5. $5 for a very small. I was like, I bought it, but I was just thinking to myself, like, yo, that's super expensive.
Yep, it is definitely more expensive to eat healthy than it is to purchase junk food. That's a great point, Javier. So Dr. Sisson, go ahead and share the comparison.
Okay, so let's see if this works. All right, so, oops, I hate it when it does that, sorry. Hang on, let's try this again. Okay, sorry it's a little small, but Zoom is not cooperating with me. Okay, so we've done this activity with many groups to come up with the list that's here. But I think what's really remarkable, and you can't see the list that you came up with, but you have nearly everything that's on this list. So I was trying to organize your comments into different buckets. So meeting the basic needs of everybody. So that's where, you know, having safe, sustainable, affordable, accessible transportation, affordable, accessible, nutritious foods. We talked about the cost of fruits and vegetables, safe, drinkable water, talked about housing. We talked about access to healthcare and parks and recreational facilities. We didn't talk about libraries or childcare or banks. We talked about physical activity and arts and music. We talked about good music. Also adapting to change and being ready for emergencies, whether it's the next pandemic or whether it's climate change and needing to make sure that as things warm that everybody has access to air conditioning. Also thinking about the environment around us, the natural environment in terms of cleanliness of the air and water. We also don't always think about noise pollution, but you notice it when it's there. Tobacco, smoke-free, having green and open spaces, including trees, but also farmland where we can grow those healthy fruits and vegetables. Thinking about climate change, reducing our greenhouse gas emissions, and also reducing our energy, and also just areas that look pretty. You feel healthier when you're surrounded by beauty. And then also really thinking about economic and social development. We talked about technology and access to the internet, but also making sure that there are jobs for people so that they can have adequate incomes. That's not something we touched on because we ran out of time. We talked a lot about education. And also really important is health and social equity and, you know, an environment without racism or other isms. So important. We've seen what happens with COVID when you don't have health and social equity and you have disproportionate burden of disease on certain populations, especially people of color. And then you guys really talked a lot about social relationships that are supportive and respectful, being able to have people you can talk to who can provide support. And that's so important for human beings. We are, you know, social animals who need to be connected to each other to have mental health and wellness, and also to be in communities where we feel safe. So you guys did a great job with that activity. I really appreciate you participating. And the whole point of that was to get you thinking that, you know, we often talk about public health and healthy, you know, healthy people, and everybody thinks it's about healthcare. And I think what you guys already intuitively understand is that having healthy people and healthy communities requires so much more than just being able to go to the doctor when you're sick. You know, it's about the neighborhood that you live in and what opportunities are available to you. So it's great that you all have such a great understanding about public health and how to create a healthy community already. And I encourage encourage you to think about working in the area of public health so you can put your intuition and knowledge to work helping people be healthier.